Hi, good evening, folks. It's Thinking Slow. So we have a couple of videos that have gone up on this channel that have stayed up. So we thought we'd try and do another one for you. And the main focus of today's video is basically the fact that some data has come out of Denmark, which shows that the incidence of Omicron is very much higher in the vaccinated than in the unvaccinated. So, but again, that's the statistics. The real point is to raise questions about what the politicians are telling you and me. And the main message again, and it's as I've done on other videos, the thing is the message. It's not the facts. The message is, get vaccinated to reduce your chances of catching Omicron and be protected. That's not true based on this data from Denmark. The most protected at the moment are the unvaccinated, and that's what I wanted to show. But I also wanted to show something that's been getting increasingly popular recently, which is great news, is the mass psychosis understanding. I think we very early on said this does not make sense, and we've been on that journey for nearly 2 years. So it's very good to see a big movement on mass psychosis. And I think Denmark, a country with less than 6 million people that's already had more than 12 million jabs, is basically a classic case of mass psychosis. You look at the actual problem being addressed and you realize the policy response is frankly insane. And you can see that by taking a step back from the sort of day-to-day statistics. And I think that's one of the messages of this video, and actually what we're doing is, although we look at statistics and charts, we're only doing that for the purposes of showing that what we're being told isn't true, or is misleading, or is twisted in some way, or is maybe the weakest case is not fully representative of the facts. So that's the point. It's not the numbers and the details of the statistics, it's what that says about the people running policy and about our politicians and media in general. So let's get on with it then. So this was an interesting chart. Again, before diving into Omicron and cases and everything else, we need to do what the media and the politicians will never do, which is provide a context. If you look at everything that they talk about and all the charts, there's never any context. There's never any context over time, going back in history, and there's no context of COVID versus other diseases. And that's all deliberate. That is part of the mass psychosis, the zeroing in, taking in a sort of very close range view of some numbers without any perspective. That's what generates panic for something that doesn't justify that level of panic. So even for me, to be honest, having been doing this for a long time, I was really amazed to see that the 2020 total deaths in Denmark were lower than 2018. Now, that's amazing because we had important people in the World Economic Forum basically telling us that we're facing the worst crisis since World War II. And then when you look at a country like Denmark, actually its total deaths in 2020, when there was no vaccine and we were supposed to be in the middle of this existential threat, was actually lower than 2018. So here's 2020, 2018, which passed without any noticeable comment or incident. Really amazing. And the total number of deaths with COVID over the last 2 years almost has been 3,307. And actually here at least the authorities are quite honest in that they actually say literally these are deaths where COVID is not necessarily the cause of death. So they're making it clear this is a with statistic. Then there's all kinds of argument about, what constitutes due to COVID and just incidental COVID. We don't need to get into those, but they're also valid questions. So in the grand scheme of things, then COVID deaths are about a third of COVID deaths over 2 years are about a third of the annual cancer deaths in Denmark. That's the scale of this thing. and that needs to be borne in mind when we start looking at the policy response. So this is another way also of looking at deaths, and it avoids, as we discussed with Professor Fenton, the whole death attribution question, where you look at excess deaths. And in excess deaths, if those 3,307 COVID deaths were sort of excess above the norm, you would see a spike in an excess death number here. And you don't see that at all in 2020, really, and very little in 2021. And the basic conclusion you can get from that is that is a lot of the COVID deaths will be deaths that have been relabeled, because these are not additional incremental deaths. Otherwise, they would show up in the total excess deaths. And actually, funnily, in this chart, this is a Z-score, which we're not going to go into the details. It's enough to say that this is represents excess deaths in a sort of score, basically. But we looked at that 2018, and that was slightly elevated. And you can see that, from this little Z-score, you can see it's been above these tram lines. So this would be classified as outside the normal range and a substantial increase. Whereas you look at 2020, which is here, and you're basically seeing nothing. It's within range. There's really nothing much to see in 2020. So, again, whatever deaths are coming in COVID, plus minus, they're being offset by other deaths that have been reclassified as COVID, because nothing is showing up really in the excess death chart. Now, I'm going to caveat that slightly, because it's always more complicated than those simple summaries, because you are seeing a little bit of excess deaths now, and that is actually a bit of a worry, and it's not Omicron related. So we're not going to get into that on this one, but just so you know, there is a caveat there. Okay, then, so this has been the policy response for COVID, and as we saw there, 2020 deaths were lower than 2018, and there have been basically very few or negligible excess deaths from COVID, or excess deaths in Denmark. And then this is what the bureaucracy has done in response to that. This is, I would say, mass psychosis hard at work. You won't see anything much like this. So 12.3 million jabs have been administered for 5.9 million people. So that's over 2 jabs per man, woman and child in Denmark. Really phenomenal. And then 55 million PCR tests. These numbers are just out of this world, to be honest. So that's 9 PCR tests per person. And then this is in addition. This is not with part of the 55 million. This is an additional 53 million antigen tests, which is another 9 tests per person. And of course, when your denominator is the entire population of a country, every man, woman and child, when you start getting into any kind of whole numbers of 1, 2, 3, you're talking about huge quantities when you add it all up in the aggregate, basically. So, when you're saying that you're doing 18 tests for every single inhabitant of a country, that is a phenomenal amount when you add it all together into a gross figure. Now, if you can think of the money that's been going out on this to tackle, let's say tackle in inverted commas, because I think we'll find this hasn't actually achieved that much in practice. So the billions, the unthinkable number of billions going out on all of this, basically, to achieve who knows what, for a disease that has accounted for, with COVID, 3.3 thousand from 54,000 deaths every year. Let's compare what's gone into this to, let's say, cancer, and you'll understand that this is psychosis, because you are literally running the country into the ground for the sake of this one disease, and that's something we need to look into, how that happened. So this is then the actual data, which was the point of this presentation, showing that the incidence of Omicron is much, much higher in the vaccinated than the unvaccinated, which brings into question the politicians constantly telling you to, get boosted for your safety. How realistic is that, basically? That's the paper. You can Google it, and I've put the link in at the end, but this is probably the key table from that paper. Now, they actually put in these numbers. This is the number of Omicron cases. So the total is 785. They did not put in these numbers because when we saw the Omicron cases, your first question obviously is, what does that look like as an incident rate per 100,000 of the relative group? And they didn't do that, basically. So immediately that's an interesting question. Why is that not there? And this is what we did over the last couple of days. So just quickly going through this, we've provided the link to this, but these are the official Danish statistics on the doses administered. And in order to match up the vaccine status with the number of cases, you have to basically work out what these numbers are based on the aggregate vaccinations for the country as a whole. So as an illustration, a lot of people have had the first dose, but then of course they've moved on and had the second dose as well. So the only number that should be in this here is the first dose only. So that's total first dose minus second dose. So those are the mathematical calculations we've done from the raw data in order to get to these numbers. And the same thing really applies for the second dose only. So that this is all of what they call fully vaccinated. But then a group of those has gone on to get the boosters, which is roughly 1 million here. So we take that million from the total second dose to get to second dose only. I think we've got this right, basically. I will post the Excel up on our website at some point, but this all looks okay to me. This is, again, a very, very low number. Let's be realistic that this is a tiny number, 785 cases. But anyway, it is what it is. This is the data up until the 7th of December. And two important things jump out, basically. 83% of the Omicron cases were from the fully vaccinated and the boosted. If you add that then into these partially vaccinated as well, you're up at about 86%. But basically, vaccination, big picture, has not given you any real benefit compared to the unvaccinated versus Omicron, and quite the opposite. Basically, if we have our vaccination numbers correct, then the incidence per 100,000 is double in the fully vaccinated of Omicron versus the unvaccinated. So basically, if you're unvaccinated, you're better off staying where you are, because obviously to get to booster stage, you'd have to go through this stage and this stage before getting to this stage. So I don't see any way of really realistically claiming that you're helping yourself to avoid Omicron by getting the booster shot. I don't see that as being true. I did also want to make a couple of comments on this number that does look lower, basically, but this is very early days. This is what happens early on when you start forming the denominator, which is the number of people boosted. So by the 7th of December, that wasn't a big number. You're dealing with a very small number of cases. What we've seen over and over again is this thing will basically average out quite quickly. So this will very quickly disappear, and this will also, I'm pretty certain, become higher than this number quite soon. But again, the key message is the incidence of Omicron in the vaccinated is double the level of the unvaccinated. So starting on your journey from unvaccinated by taking the jab is not going to protect you against Omicron based on these figures, basically. And I hope that's not deleted for saying that, because this is the data, basically. It's from more or less a technical paper with a couple of adjustments, but that's basically it. and if it is deleted, it'll be on another channel. So we'll see what happens with that. So the other reason I wanted to do this paper is there's quite a lot of honest, surprisingly honest assessment of how useful these restrictions have been. And there's one thing particularly I want to talk about is travel restrictions. So, let's just read this essentially. This is verbatim from that paper. Despite the capacity to detect Omicron cases early, implementation of travel restrictions and extended contract tracing efforts, more than 1 in 5 cases cannot be linked to previous cases. This indicates that within 1.5 weeks from identifying the first case of Omicron, there is already widespread community transmission. This is what the crux of this is all about. The bureaucrats are pulling all these levers and pushing all these buttons. And very importantly, I want to state this very, very clearly, that these levers and buttons did not exist and were never, ever contemplated in any pre-2020 pandemic response plans. All of this stuff, the masks, the travel restrictions, the lockdowns, were all actually specifically excluded from pre-2020 pandemic planning. So this stuff has been made up on the hoof, and we covered that in another video, and essentially this is saying this isn't working. Now, I particularly wanted to do a comment on the travel restrictions because they've been very specific here, that they put in travel restrictions against South Africa, and what we see in this paper is exactly 100% what we had on video with Dr. Quinn. If you want to go back to that, he basically said very clearly, the naming a variant, the South African variant, has absolutely no relevance to where it's come from. That's where it's been sequenced. So it has no relevance whatsoever to where it's from. And this has been a perfect case study because they put later in their write-up, which is surprisingly honest, that actually before we started making travel restrictions on South Africa, it's clear this variant had already come in from Qatar and from the Netherlands. So the label South African variant meant nothing, and putting in travel restrictions against South Africa was pointless because the variant had already come in through Qatar and the Netherlands. So this is exactly what Dr. Quinn said. This is pointless. And again, this is exactly what pre-2020 pandemic planning says. And I can show you this. I think it's on some of the other material from the modeling group. Do not model any international travel restrictions because essentially they're pointless, or at best the damage that they cause far outweighs any pandemic benefit from reducing spread. Now, the only real option is in New Zealand, where you cut the whole country off from the rest of the world essentially forever. Which is, I think now people are seeing how ludicrous that was, and we said that was ludicrous right from the beginning, and I think that's panning out. So, and the other bit of honesty here is, they reproducing the number that we mentioned. 83% of Omicron cases are in the fully or booster vaccinated, and that's excluding the odd 2% from the partially vaccinated, one dose only. So, they've made an honest assessment of, what this is. So the mitigation measures really have not added up to anything. The virus has turned up and spread. And they appreciate there's an extraordinarily high concentration of Omicron in the vaccinated. Now, that raises a whole bunch of other questions about the impact of vaccine on immune response that we won't get into here, because we've discussed that with Professor Bhakdi right at the beginning of this whole thing, and I think that was very clear then, basically. And again, this could well be initial signs that the immune response of vaccinated is basically limited, and that's making them more vulnerable to Omicron as a new variant, at least from the infection side. But we will speak to some experts about that and get some follow-up. So, and then just rounding up, basically, the idea that vaccination isn't protecting against infection is pretty now widespread, I'd say. And this is another technical paper. Here's the data. This is cases versus percentage fully vaccinated. This is a credible paper. It's been published in a journal. I put a link at the end, but this is basically more vaccination is associated with more cases per million. So again, this is playing into the same conclusion that vaccination is not helping against cases, stroke, infection, and if anything, it's kind of pushing that level up a bit, basically. So the Denmark data is not in a way out of line, basically. It looks credible compared to this cross-country analysis. Each of these dots is a separate country. So I think that was really the wrap-up from this. What is making the vaccinated people, at least on this small sample, more susceptible to Omicron in terms of cases per 100,000 than the unvaccinated? Big question. Can speculate quite a bit on that, but it is a question. And again, what you're being told is just for the unvaccinated, it looks like you're better off staying where you are. That is the lowest, essentially, incidence per 100,000, because you can't get to the booster without going through the other stage. And at the other stages, you're going to get higher incidence of Omicron, so more likely to catch it. So, the political message is not in line with the data, again, basically. And they're pursuing some kind of dogmatic program, it looks like to me, irrespective of data. And we covered that in other videos, that they, first and foremost, is the messaging. The facts somewhere distant, second or third. So, and just wrapping this up, because I think Denmark is a good example of this mass psychosis, a policy response that I think any person would have to say is just ludicrously over the top for the threat that they're facing. And again, the real threat, if there is a threat, is overburdening the hospital system. I don't remember I think the number right now at the moment is 76 people in intensive care in Denmark for a population of 5.9 million. So there should be, that's a manageable level. And again, if that's your problem, then fix that problem, i.e. spend some of the last 2 years developing some more critical care beds, rather than doing what's been done with money going up in smoke, essentially, on 110 million tests. I mean, I can hardly believe that number. So you're trying to basically, I think Peter Hitchens said, you're burning down the house in order to remove the wasp nest from the roof, and that is basically what that policy response is all about. And then we get into our old friends. I don't want to say too much about this because we don't want this deleted, but it's clear now. It's getting clearer and clearer every day, and we called this out a long time ago, that the Davos World Economic Forum has a massive influence over domestic policy setting, and we trace that back through the testimony of Dominic Cummings. And then here's another clue for Denmark. They've entered in this cooperation agreement, which, to be honest, I haven't read, but it covers an awful lot of policy grounds. And what this is doing is pulling the government away from its social contract with the people, and all of a sudden you have this sort of oligarch club in Davos who is basically setting policy objectives and priorities. I can promise you one thing from my experiences: those people do not live in the world that we live in. They have essentially no understanding of, and I would suspect very little interest in, what interests ordinary folk. And when you have a group like that having a serious influence on policy setting, you're bound to get policies that are not for the common good. And I think that basically is what you're seeing, and this agreement probably needs a little bit of looking into. How much influence does this oligarch club have over Danish politicians. Judging by this, I think it's much higher than it should be. And I think that may well be a factor in the reason that you have this mass psychosis and this huge reliance on vaccines and testing. There's a role for those things, obviously, but I think every sane person would agree that 110 million tests in a country of 5.9 million is completely over the top for a disease that's registered no excess mortality in 2020, very little in 2021, and is not significant compared to cancer or other main leading causes of death. They've gone overboard basically, and I'm pretty sure the influence of this oligarch club plays an important role in how that mass psychosis has occurred. So, and then just closing up, we put this here, not because we want to criticize people post factum when everything's already clear. We do this Monday morning quarterbacking where we already know what's happening and then we criticize what the people on the pitch did. That's not the point of this. The point is that a large number of people actually very early on looked at data and understood what was going on did not make sense. They understood the Ferguson model was flawed, the assumptions were flawed. Pretty early on there was a lot of good data about the lockdowns not working. So, this is not about politicians struggling with an evolving situation. This is about politicians doing knee-jerk, stupid things based on, I would say, inappropriate influence from this oligarch club. And I think the important thing also to add here is bits of emails now have been started to be released, and we've seen quite a common pattern now of smearing any reputable scientists who were against this approach. And I think I can't even say the name because I know it's going to be deleted. But there's been evidence of that basically. So we're not talking about a heroic group of government bureaucrats fighting against emerging data. We're talking about a bunch of guys that set a one-size-fits-all policy, a policy that was never ever contemplated prior to 2020. So all these things were made up on the hoof. Lockdowns, universal mask wearing, testing once something had become endemic, border closures, and on, all of that stuff was made up on the hoof. And they ignored anyone, not only ignored, but they basically vilified and silenced anyone that said this does not make sense. So we're not talking about a bunch of well-meaning bureaucrats. We're talking about some pretty, I would say, and certainly in some cases from the emails we've seen, pretty unpleasant guys pushing through radical, untested policies and just basically smearing anyone that got in the way. So I have no sympathy for these people. If they'd looked at the data, if they'd listened to very credible scientists, they wouldn't have gone down this path. So they should be held accountable for this. There should be full accountability for all of the fallout from some of these crazy decisions. And then as I'm closing up, I like this quote, one of my favorite quotes. And as we say to all of our viewers, do not stay safe, stay free, because if you're not free, you're definitely not safe. If you look back at history of this sort of one-size-fits-all totalitarian government where the ruling elite makes a decision that they then impose on everyone, that's a totalitarian system. It's a system quite often based on the merger of business and politics, which is what we're seeing. And it's very, very dangerous. And it's much more dangerous than COVID-19. So don't stay safe, stay free. And these are the sources for the data which people have asked for. And a lot of this is going to be posted up on the website. So the main thing is please also subscribe, because this channel will only function. We've got a very interesting year planned for 2022 with some fantastic guests. We've had Professor Bhakti, we've had Professor Fenton, many others that have made a fantastic contribution to the debate. But that can only continue if we get some subscribers, and probably during the course of the next quarter we're going to ask for some financial help in at least covering cost, because this is a very time intensive and somewhat less costly in dollar terms, but very time intensive, and we really need the comments to come in. We need the subscribers, so please subscribe, turn on the alerts, follow us on Twitter, go to the other platform that has basically videos that have been taken off here, because there's some very good stuff in there, and I think our future is not on this platform basically, but if we can develop this, you'll get a lot more good material coming from us and some fantastic guests. So please subscribe, grab someone, get them to subscribe, and then we're basically off to the races. Okay, thanks, bye.